All right, welcome to The Explainer. Today, we're diving into a real medical mystery, one that affects thousands of people every single year. It's the strange case of a stroke where all the clues, all the evidence, just seem to vanish, leaving everyone completely in the dark.
I mean, just think about that for a second. What if you had a stroke? This massive, life-changing event. You go through this whole battery of tests, brain scans, heart monitors, endless blood work, and after all of that, the doctors just turn to you and say, "We have no idea what caused it." This isn't some far-fetched scenario. It's a deeply frustrating reality for so many people.
And get this isn't some rare 1 in a million thing. We're talking up to 30%. That's almost 1 out of every 3 ischemic strokes, the kind caused by a clot, falls into this mystery category. Let that sink in. For every 3 people who have this kind of stroke, 1 is left without answers, and more importantly, without a clear way to prevent it from happening again.
The official name for this is a cryptogenic stroke. That word crypto comes from the Greek for hidden, so it's literally a hidden stroke. It's a diagnosis of exclusion, meaning you only get that label after every other possible cause has been ruled out. So that's the big question, right? How on earth do you find a cause that's so good at hiding?
Well, it turns out investigators have a prime suspect, a hidden culprit that they believe is secretly behind a huge number of these mystery strokes. And that suspect is a very common heart condition called atrial fibrillation, or, as you'll hear it called, AFib.
So what exactly is atrial fibrillation? In simple terms, it's when the top chambers of your heart, the atria, just start quivering chaotically instead of beating in a nice, strong, regular rhythm. It's kind of like a drummer who's completely lost the beat. This shaky rhythm can cause a really fast pulse, but here's the sneaky part. Sometimes the pulse can feel almost normal.
So how does this shaky heartbeat actually lead to a stroke? Well, it's like a dangerous domino effect. First, that irregular beat means blood doesn't get pumped out of the heart efficiently, so it can start to pool and get stagnant. And stagnant blood, it's the perfect recipe for a blood clot to form. Then, if a little piece of that clot breaks off, it can get pumped out of the heart and travel straight up to the brain where it gets stuck, blocks an artery, and causes a stroke.
So, if it's such a well-known cause, why is it so hard to find? Because AFib is an absolute master of disguise. For a lot of people, it's totally silent. No symptoms, no dizziness, no palpitations, nothing. And to make it even harder to catch, it's often what doctors call paroxysmal, which is just a fancy way of saying it comes and goes. An episode could last just a few minutes, then poof, it's gone.
And that right there makes catching it a total game of chance. You see, the standard workup after a stroke usually involves a 24 or maybe a 48-hour Holter monitor. But look at this scenario. You wear the monitor on day 1 and everything looks perfect. But then 2 weeks later, on day 15, you have a short, silent burst of AFib. While the monitor's long gone, the test comes back normal, the doctors are stumped, and the case goes cold. Okay, so if our culprit is a master of the disappearing act, a quick spot check just isn't going to cut it. To catch a villain this sneaky, you need a detective that's on the case around the clock. And that's exactly where some really clever technology comes into play. The solution? We're talking continuous heart monitoring with a device called a loop recorder. Instead of just taking a 24-hour snapshot, these devices are like a surveillance camera for the heart, recording its rhythm for weeks, months, or, get this, even years. It just dramatically increases the odds of catching AFib red-handed.
And you've basically got 2 types of these long-term detectives on the case. There's the external loop recorder, or ELR. That's a patch or a small device you wear on your chest, and it monitors you for up to 30 days. But for the real long-haul investigation, there's the implantable loop recorder, or ILR. It's a tiny device, about the size of a matchstick, that's placed just under the skin and can stay on the job for up to 3 years.
I mean, the tech here is just incredible. Think about it. This tiny little thing, just under your skin, is keeping tabs on your heart's every move, 24/7 for years. It has these smart algorithms built right in so it knows what to look for. And when it detects an abnormal rhythm like AFib, it automatically records it and can even send that data wirelessly to the cardiology team. It's like having a cardiologist watching over you, day and night.
Okay, but does all this fancy, long-term surveillance actually pay off? Does it really crack the case of the cryptogenic stroke? Oh yeah, the evidence is in, and it is absolutely dramatic. So, let's look at the EMBRACE trial first. This study compared the good old 24-hour monitor against a 30-day monitor in these mystery stroke patients. The results? Honestly, they were staggering. The standard 24-hour Holter only caught AFib in about 3% of patients. But the 30-day monitor? It found it in over 16%.
That's 5 times more diagnosis, just by watching for a little bit longer.
But hold on, because the story gets even more stunning when we look at the Crystal AF trial. This one used that 3-year implantable monitor. With standard care, doctors only found AFib in about 3% of patients over 3 years. But the group with the implantable monitor, they found AFib in an incredible 30% of them, a 10-fold increase. This just goes to show how many of these AFib cases were hiding in plain sight, completely missed by the old ways of doing things.
And if you need a real-world story to drive this home, listen to this. A 65-year-old woman had a mini-stroke, so she got one of these implantable monitors. For almost 3 years, nothing. Every check was normal, but on the very last check, right before the device's battery ran out, it revealed the truth. She'd been in silent, continuous AFib for the entire last week. Can you imagine? Without that long-term detective on the job, her case would have gone cold forever.
Okay, so we've established that we can find this hidden culprit. We can crack the case. But why does that matter so much? What's the big deal? Well, it's because finding that AFib diagnosis is an absolute game changer for preventing the next stroke.
Well, check this out. Before you have that diagnosis, a patient with a mystery stroke usually gets put on an antiplatelet, something like aspirin. But once you find the AFib, bam, the whole treatment plan changes. You move from aspirin to a much more powerful and targeted type of medication for this problem, an anticoagulant, what most of us call a blood thinner. They work in a totally different way to stop those specific kinds of clots that AFib causes.
And that simple switch in medication, it's literally life-saving. For patients with AFib, we know from major studies that using the right anticoagulants slashes the risk of another stroke by 2/3. 2/3. That is just a massive, massive difference. And it all starts with getting the right diagnosis.
So you see, solving the mystery of a cryptogenic stroke isn't just about giving a diagnosis a name. It's not some academic puzzle. The real goal here is prevention. It's about finding that hidden cause so we can start the right treatment to stop the next, potentially even more devastating stroke from ever happening.
And that, of course, brings us right to the cutting edge of all this research. We now have the tools to find these incredibly short, fleeting episodes of AFib. But the big question that scientists are tackling right now is a 5-minute blip of AFib found after 3 years really as dangerous as having it all the time? Does the amount of AFib, what doctors call the burden, change the risk? We've got this amazing new detective on the case, but like all good science, solving one mystery just opens up the next chapter of the investigation.